Hi, and welcome back to the Modern Pain Physician YouTube channel. I'm your host, Dr. Kent, and today we're talking about treatment options for spondylolisthesis, or instability of the spine. Oftentimes you'll hear it referred to as a, quote, slip disc. So treatment options depends on the symptoms, and so you can't determine the symptoms based on just seeing these findings on imaging. You really have to talk to the patient and see where the pain is located. And so spondylolisthesis associated with pain going down the arms or pain down the legs is usually a result of a pinched nerve causing spinal stenosis. If you haven't seen my video regarding spinal stenosis, you can look back at that video to refresh yourself on the causes of spinal stenosis and treatment options. Typically the treatment option for a pain going down the arms and pain down the legs coming from a pinched nerve is injecting along the nerve. Other options, so if there is no pain going down the arms and legs and the pain is just along the spine, then the options for treatment start involving things like treating the facet joints or arthritis of those facet joints at that same level of the instability. If the patient has severely degenerative discs with inflammation along the end plates or along the sides of the bone above and below that disc, then you start talking about things like basivertebral nerve ablations. If there is atrophy or weakness of the muscles in the back, you can strengthen those muscles through physical therapy or newer technologies using basically neuromodulation or stimulating nerves in the back to strengthen the muscles. That can be a way to stabilize that segment. And lastly, especially for dynamic or instability that moves as you bend forward and extend back, typically the only treatment we have for that is to basically correct that problem is a fusion procedure. And so what that involves is usually coming from the front of the spine and putting in a cage or taking out whatever disc space is left and putting a device in there that fuses the front of the spine. And then oftentimes the surgeons will put in hardware in the back of the spine as well to kind of lock it in place and allow that fusion to occur. But that is one of the kind of the ends of the road, if you will, for spondylolisthesis and to correct instability. But you don't necessarily need surgery if there's no instability. So if the bone is offset, but there's no dynamic movement, when you flex forward and extend back, that bone isn't sliding back and forth, then oftentimes surgery isn't necessarily indicated for that problem unless you're starting to talk about pinched nerves or just refractory pain. And so fusion is an option for this problem and is truly the only way to really fix the problem, if you will, and kind of bring that bone back into the normal alignment or the normal space that it's supposed to be in. Thanks for visiting, or thanks for seeing the video today, and be on the lookout for additional videos regarding other problems with the spine and those treatment options.